My name is Carla Freitas, and I will present the work entitled Interactive Visualizations to Support Randomized Clinical Trial Monitoring. Marina Rey and myself developed a visualization-based interface to support the monitoring of Linda Brazil, a long-term clinical trial conducted by epidemiologists at the Federal University of Rio Grande do Sul. Linda Brazil is focused on a lifestyle intervention program for women who have gestational diabetes. The intervention aims at preventing type 2 diabetes. This intervention is based on regular phone calls when coaches encourage women to exclusively breastfeed their babies for a longer period of time, to reduce their current weight, to seek healthy eating habits, and to maintain regular physical activities. Linda Brazil follows a sequence of phases. First, women that are diagnosed with gestational diabetes are recruited into the study. They are followed up by coaches with regular phone calls. If a woman is eligible to participate in the trial, she is invited to a clinical visit for baseline testing and is randomized into intervention or control group. The study proceeds with phone calls and yearly visits until the last one, scheduled for 5 years after the randomization date. Linda Brazil is a multicentric study. Women that are randomized to the intervention group receive intensive personal coaching based on data contained in a monthly generated report. During phone calls, the coaches fill in questionnaires. During visits, exams are made, and other questionnaires are filled in too. Women in the control group receive a booklet with guidelines and have scheduled visits where questionnaires are filled in. At the end of the study, the main outcome observed is whether or not the participant developed diabetes. There are several secondary outcomes which mainly assess whether the participant was able to apply the changes proposed by the study in her lifestyle. We will see that our visualization techniques allow monitoring the progress of the factors related to the secondary outcomes. In our work, we investigate the benefits of interactive visualization techniques to the workflow of Linda Brazil epidemiologists. Related work can be divided into 4 categories: systems that display patient data as a time series with a common time axis, systems that are based on dashboards, those that aim at displaying similarities between patients, and finally, systems that allows comparing and analyzing cohorts of patients. Starting from Lifelines in 1996, we can find systems that typically show a timeline with data regarding patients, mostly one patient at a time. However, they usually do not provide an overview of patient information beyond the data shown in the timeline. The dashboard-based systems focus on presenting all the information for a single patient or a group of patients in a single dashboard. This type of interface is usually static and limited to a certain amount of information. Systems that aim at presenting similarities between patients, like Gravy++ and TimeRider, show patients as dots in a graph based on users' chosen variables. In these cases, points close to each other represent patients that are similar regarding the selected variables. Finally, there are systems like Kava that shows an analytic overview of a cohort of patients, while Coco directly compares cohorts for a few metrics. We analyzed related works based on characteristics we found in a survey by Ryan and co-authors. We can observe that most systems display categorical data, while some do not include numerical data. While most of survey tools separate views of single or multiple patients, our work presents a hybrid approach, allowing users to interact with the cohort of participants while viewing specific information from each subject of the study. Most tools are limited to presenting a few data on a single view, while our work can show an overview of around 90 different variables. After a year of meetings and interaction with experts, presenting and evaluating prototypes, we were able to provide a visualization-based interface for the Linda Brazil clinical trial, where high-level tasks are supported by interactive visualizations. We found out 3 high-level tasks during our meetings. The first is gather data to perform follow-up calls. The coach needs to have information about the participant so she can track the participants' progression to assess the effectiveness of the intervention. This data is displayed on the participants' dashboard. The second high-level task is track participants' progress to identify the effectiveness of the intervention. The coaches need to check the temporal variables associated to the factors that are related to secondary outcomes to identify incorrect and missing data and similar participants that might indicate dropout cases. These tasks are supported by the Participants Information Analysis view and the Variables Selection view. The third high-level task is track trials completion progress and assess lapsed participants, which needs the information about questionnaires completion per phase. The questionnaire status view allows the epidemiologists to track the study status for each participant. In the participant's dashboard, the coach has all the information about the participant, including the questionnaire completion status. The chart in the center of the dashboard shows the participant's weight over the years and the important events like the dates of childbirth and randomization. By selecting the Variables tab on the right, the coach can access charts displaying all the data collected for that participant over all phases she has already went through. This temporal data is shown in specific charts depending on the category. Some variables are actually groups of subvariables, which are shown in a single chart. The other three views will be described in a demonstration of a usage scenario.
In this video, we will show a typical user scenario, assuming A is a coach team member responsible for making phone calls to participants and also tracking their progression during the trial. Coach A needs to check the progress of a number of participants that are under her care. She lists the ID numbers of the participants she needs to contact soon. Then she accesses the Participants Analysis interface and enters her appointed participants' IDs on the search bar at the upper left corner of the interface. Their corresponding dots are outlined in black in the overview visualization, and subsequently, their temporal variables are plotted on the right side of the view. This visualization allows Coach A to check their progression and compare the evolution of participants as a group. She can obtain more detailed data about each one by hovering an entry on any of the graphs, which also causes highlighting the participants in all other views. She clicks on the bookmark button on the top of the interface, thus saving the outline group of participants. Such an action allows her to retrieve this group if she alters the selection. Coach A would like to compare the selected participants to others on the same field center. She enters the menu options, Filter Participants, and checks the available visualizations. They show that every field center and randomization group are currently selected. Coach A then clicks on the button at the top of the field center visualization to deselect all research centers. All subjects are deselected, and she observes the movement of participants in the overview visualization. Since A is only interested in viewing participants from Porto Alegre, she selects that city on the map. This will cause all participants from Porto Alegre to re-enter the center of the overview. She is also only interested in comparing participants belonging to the intervention group, so she deselects the portion of the chart representing the control group of participants. Now, participants that are from Porto Alegre but belong to the control group are moved out, to the right side of the overview visualization. A would also like to exclude from the included participants anyone that lost contact with the trial for more than 300 days. To achieve this, she enables the lost contact filter and moves the area selected until it reaches 300 days. There are a few participants that have certain variables with wrong values and should be excluded from any analysis performed. She has a list of these participants' IDs and enters them on the search bar at the upper left corner of the screen. The subjects are outlined in black in the overview visualization, and new buttons appear on the top right of the page. A clicks on the button that allows excluding outlined participants from the selection, and they move to the set of filtered participants painted with a stronger shade of gray. Now, Coach A would like to check what questionnaires were already completed for her participants. Then A clicks on the questionnaire status menu option, and the corresponding visualization is displayed with her participants highlighted and shown in more detail. In the detailed view, she examines if there is any survey left incomplete from previous phases, or if the patient is late for the next phase. Next, Coach A selects the menu option Select Variables and decides which variables from which phase she wants to use for comparison. By checking the histogram matrix visualization, she can see a normalized distribution of the participants' traits for each combination of variables and phases. Furthermore, by hovering a specific participant in the overview visualization, the matrix highlights the bins of the histograms the hovered participant belongs to, showing which phases she has already completed and which variables are recorded for her. She decides to inspect the evolution of specific aspects and selects variables of physical activity, weight, accelerometer to phases basal 1 and visita 1. This action highlights all histograms of the selected variables and phases in the matrix, while also filtering participants in the overview visualization to remove those that do not have enough information to be displayed. Next, she can check whether her participants, those from her first list, were filtered out by such actions. Since they weren't, she can proceed to the See Results menu option. In the See Results option, the PCA-based scatter plot is generated for the basal 1 phase with all unfiltered participants. A timeline at the bottom of the page shows all the chosen phases, basal 1, visita 1, each displaying a different visualization when selected. Her participants are also marked with a black outline in the scatter plot, which can help her to find others that are close to them, meaning they show similarities regarding the previously chosen variables. She assigns loss of contact as the color of each participant in the scatter plot. Coach A now selects 2 of her participants directly from their scatter plot to check their temporal progress and similarities. In PCA, typically, some of the variables have more considerable influence in the position of points, which can be seen clearly by analyzing the graphs showing the selected variables. She can interpret how their personal histories evolved along with the phases of the study and what other aspects could have influenced this outcome. After comparing these close subjects, she can return the selection to all her participants by loading the previously bookmarked selection and repeat the analysis until she finds any interesting facts.
During all the design process, we performed informal evaluations of our prototypes with the Linda Brazil team. In this presentation, we chose to briefly present the main results of 2 formal evaluations we conducted as a final assessment of our interactive visualizations. At first, we had the application evaluated by 3 experts. 2 of them were part of the Linda Brazil team, and the third one was external, but also worked on clinical trial monitoring. We allowed them to use the tool freely and collect answers using the System Usability Score questionnaire and the User Experience questionnaire. We also asked specific questions about each visualization. The scores resulting from the System Usability and User Experience questionnaires were above average, as you can see here. We had also positive feedback for all the visualizations except for a few neutral answers. After the evaluation by experts, we invited non-experts to experiment with our tool. 16 people agreed to participate. Most of them were male, less than 28 years old, and computer scientists. This evaluation aimed at assessing the general usability of our tool. You can see here that both the System Usability Score and the User Experience results were higher than the ones we obtained from the experts in most aspects. You can find more details about the evaluations in the paper. In summary, our contribution is a visualization-based interface that provides an integrated and detailed overview of all data collected from any participant that allows coaches to assess the effectiveness of the intervention. A visualization of the current status related to all study phases for each enrolled participant that allows to assess the progress of any participant or group of participants. A histogram matrix showing the distributions of all variables for any phase of the study that serves as filter or parameter selection for further analysis. and a scatter plot-based visualization that allows investigating similarities between women, which is particularly important to prevent participants from leaving the study. As future work, we would like to provide visualizations to compare multiple cohorts of participants, to include statistics for subsets of participants, and to deal with data from different clinical trials. Thanks for your attention.